Good day, everybody. We are here live with you guys for another wonderful interview with wellness influencers. Today we have the amazing Dr. Ruben Valdes. He is a functional medicine doctor and a chiropractor, and he has been described as a Jedi of the functional medicine. So welcome, Dr. Valdes. Give us an introduction, sir, and we will dive into it.
Thank you so much for having me, and it's a pleasure and a privilege to be part of your community, part of your listeners, and I'm here to basically give you everything I got, so ask away.
Fantastic. Our listeners, Dr. Valdes is a world-renowned international speaker. He has published 3 books, and he's amazingly sought after when it comes to treatment of cognitive disorders and thyroid dysfunction. So let's start with thyroid dysfunction, especially hypothyroidism. Give us your bit about that, Doc.
Yeah, low thyroid is a very, very sad story in the United States of America. Most women that are either dealing with a thyroid problem, suspect they have a thyroid problem, or even worse, have a diagnosis of low thyroid, have a very similar experience over and over and over in the conventional healthcare model. They go to their doctor, they report these symptoms that we all know about, right? Weight gain, loss of energy, mental fog, changes in their moods, anxiety, to a certain degree, depression, changes in their skin, thinning hair, their hormones are all over the place, their menstrual cycle becomes irregular. And when they approach their doctor with these symptoms, it really doesn't take a rocket scientist to say, yeah, this really sounds like it could be your thyroid. They go, they get some testing, and when they come back, they're kind of excited, they're anxious, they're waiting in anticipation. And most of the time, they're told, yeah, you definitely have low thyroid. And before the word hypothyroidism is even coming out of their diagnostician's mouth, they already have that script for hormone replacement therapy, which they're told they now need to take for the rest of their lives. Most of these patients, they're very excited, they're hopeful, I'm going to start getting better. Okay, I don't want to be on a drug lifelong, but this is what I need to kind of be myself again and get back to myself. And sadly, what they experience from there on out is nothing further from the illusion and the hope that they had to recover their health. So many of them continue to struggle with exactly the same symptoms. And now the worst part about it is that they're going back to their doctors, they're being retested, and they're being told, guess what? You're in range, you're doing fine. So the fact that your symptoms are persistent has to be because of all of these other things, right? It's because you're getting old, it's your genetics, you're now becoming menopausal, you're too stressed, or whatever it might be. But the reality is, as you and I both know, is that there's a much deeper problem laying at the core underneath the surface that's not being examined, addressed, and much less treated. Now, there's 2 problems with that. Number one, the number one reason why people develop low thyroid here in America and in the entire world is actually a very severe problem that commonly leads to other major health complications. And number 2 is that unfortunately, the only thing that's done for these patients is being given a hormone replacement regimen while a much more complex disease process is happening underneath the surface. And then people wonder, hey, why is, Synthroid or Levo the number 1 selling drug in America?
So basically,
it's no mystery to the mystery.
So they're treating the symptom of the bigger picture of the disease that's going on, but you're basically treating one of the symptoms.
Absolutely, one of the symptoms. And as we've both been trained, we know that there's probably 5 to 6 major reasons why somebody develops low thyroid in the first place. And on top of that, there's about 20 25 contributing factors that all feed into the reason why you're low thyroid. Now, I don't know if this is kind of clicking, but we can't approach a problem that's this impactful in a woman's life like if we were, bad mechanics and saying, turn the car on, it's making a weird noise. Well, you have car not working syndrome, right? So since you have car not working syndrome, just dump this oil in the car and we'll see it in 3 months and let's see what the car's doing then. And then the car kind of comes back and what's going on with the car? Well, it still has car not working syndrome. And so all of these other things are always put to blame, but the reality is that no one is taking the time to really dive deep and look at what is going on with this individual, with this unique human being that continues to struggle and to suffer, and that the healthcare system that they're putting their trust and their dependence in is failing them over and over and over again. You look at these patients 10, 15, 20 years down the road, they are beat up, they are frustrated, they're depressed, they're getting sicker and sicker, they develop multiple autoimmune diseases, their risk for cancer is through the roof, and they're being told the same stuff for 15, 20 years. Imagine being in those shoes. What a horrific situation. And I feel so privileged. I feel so honored that as part of our core training as doctors of chiropractic, and on top of that with specialty training in functional medicine, we are some of the few people in the entire world that understand that without addressing root cause, true health can never exist. This problem is becoming so endemic, so epidemic, that if you are currently a female above the age of 65, you have a 1 in 3 chance of having hypothyroidism or some type of low thyroid dysfunction. That is 33% of our female population.
Wow.
If you're a female above the age of 40, you have a 1 in 5 chance of living with a thyroid disorder that you might not even know about. And so people say, man, this topic about thyroid is really hot and, everybody's kind of talking about it. I really believe that all of us in our profession have a profound responsibility and a duty to be kind of the forefront, the voice of true health care. Not sick care, not the thing that we've been given and offered as a solution, but the true voice of healthcare, the providers that understand what's going on underneath the surface. And if we look at the philosophy of what we do at its core, I had the opportunity of going to Palmer College, right, a very philosophical school. And there I learned that thyroid function controls tone of the central nervous system. So even at that level, when we're trying to affect change in the central nervous system, if these things are not being looked at, if they're being ignored, I think that we're really doing a disservice to our patient population.
I mean, thyroid is such an important hormone and it controls so much in our body that ignoring thyroid is absolutely detrimental to our well-being. And a lot of people have different ideas about why hypothyroidism does happen. But one of the most valid researches shows that it's an autoimmune disease, and the body basically attacks the hormone and the thyroid gland and so on. Now, in your research, what has been the predominant cause of this hypothyroidism, especially in our North American lifestyle?
Yeah, so without a doubt, 92% of the entire low thyroid population is low thyroid because of Hashimoto's. Now, Hashimoto's is a very complex animal. Much like any other autoimmune disease, there are a finite number of triggers that can cause the immune system to become overactive, undifferentiated, leaving that immune system in a position where it becomes very difficult recognizing self to non-self. Now, as far as known triggers for autoimmunity, I'm going to start naming off a few, but here's the really important part. And here is the piece that really will create a highly successful clinician in stopping and remitting the disease process versus a clinician that's kind of maybe helping with symptoms, maybe improving quality of life, but might not be really stopping the disease at its core. There is no one single trigger for any one individual. The reasons why people develop autoimmune disease are as unique as their fingerprint, right? So let's talk about the 36 potential triggers, right? We all know about the risk of viruses like Epstein-Barr, cytomegalovirus, leaky gut syndrome with increased membrane permeability, driving molecular mimicry. We can talk about hormonal surges, chronic surges, like those brought about by insulin resistance, where insulin spikes every time we eat, cortisol surges from stress, adrenaline surges, estrogen surges in younger females that are on hormone replacement therapy. We can talk about chronic inflammation from the diet and the way that this person has been eating for the last 15, 20 years, having a mismatch with their genetic code. We can talk about the exposure, the massive exposure of toxins that we're all having on a day-to-day basis. Current studies say that every day we're being exposed to nearly 700,000 toxic chemicals per day, from the stuff we put on our body to what we wash our clothes with, to what's used to clean the spaces in which we live, to what's put in our food, to what we inhale from the fumes of life outside, you know. And so this becomes very, very burdensome for our bodies, and it just creates this biochemical insanity. The important thing to understand is that no one of these things is more important or more critical than the other. These things in combination, and in most individuals, you're going to see that there's usually 4 to maybe 6 things that are what are genuinely and positively disrupting the matrix, right? Homeostasis, and really driving that immune system up. So the key to be truly successful with a thyroid patient, with a Hashimoto's patient specifically, I would attribute it to 2 key elements. The first one is the patient's understanding and commitment to their own health, to their own healing. Now, if they're only being told that their problem is a hormonal deficiency, and that, hey, you know, it is what it is, it's so prevalent, you have a hormonal deficiency, that problem within themselves is going to feel that big, right? When in reality, we know that it's a problem that's that big, right? And so making that clear and seeing and evaluating if this patient is in a place within themselves where they're fully committed to make their health a #1 priority, whatever that may mean. Well, if that means changing lifestyle, changing diet, changing nutrition, changing stress management, whatever it means, if you understand the implications of this disease process, which we can talk about over time, then the next step is, how ready am I right now to begin to do the things I need to do to heal from this disease? And then #2, the second piece is making sure that you're working along a provider that has the tools to test you profoundly, to test your blood chemistry, your hormones, to test your toxins, your inflammation, and that understands that there's good tests, good quality tests, and that understands that there's some tests out there that might sound great, but actually don't really give you very valid data. Those 2 pieces, if they come together, you're going to have a very, very successful outcome with every single case that walks in through your door complaining about persistent low thyroid symptoms.
Dr. Valdes, you opened a huge can of worm here, and especially when it comes to hypothyroidism, you know that our populations suffer in silence. And unfortunately, I have come across, I'm sure you have too, that our patients are used to saying, give me this pill, it will fix everything. But they don't recognize that it really doesn't do it. It's just masking the symptom. The underlying cause is still there. So what do you suggest and what do you recommend for people who do have Hashimoto, active Hashimoto's disease, and what's your recommendations?
Well, yeah, absolutely. The first thing is, and as crazy as this is to even say coming out of my mouth, is that most people that have Hashimoto's don't even know they have Hashimoto's because nobody's testing Hashimoto's, right? And yet 92% of the people that are suffering from a low thyroid condition are doing so because they probably have Hashimoto's, right? So that's the first thing. If you haven't confronted your primary care provider, your endocrinologist, your family provider, it's time to be a little bit on their face and be like, hey, doc, you know, I've been reading, I've been learning that what might be going on with me is a lot more complex than just a hormonal deficiency. Why haven't you tested me for Hashimoto's? Here's going to be their answer. Well, we know that most people with low thyroid have Hashimoto, so it really doesn't change the course of treatment. Do not accept that answer. That answer comes because at their core, the core of their training is pharmacological. That is what they do. That model of care, even though extremely useful for many things, when it comes to chronic diseases like this, that model is about naming the disease, diagnosing the disease, and once it's named, putting you on a standard of care treatment that is the same treatment for every single person. It does not look at why you have the disease, what are the reasons why the disease is persisting in you, why the symptoms are not resolving. There's no digging, there's no discovering, there's no process of investigation. And for medicine and healthcare to be really, really good, it has to be personalized, it has to be customized, it has to be individualized to that unique patient. So that would be my first and most important recommendation. Second, make sure you find a provider that is in the loop, in the world of functional medicine. And here's how you know. I've seen it, I see it all the time. Part of my job, we help doctors open functional medicine centers around the country. And sometimes I'm approached by doctors telling me like, hey, I like functional medicine. I'm starting to do functional medicine. And the extent of that for them is giving their patients vitamin D and giving them omega-3s, you know what I'm saying? And that is, you know, and giving them a paper with some type of diet, and that's not true functional medicine. Doc, you know the amount of work, the amount of training, the amount of detail that we need to go into to make sure that we're giving that patient the true experience of what functional medicine is. And so that would be my second recommendation is do your homework, connect with the provider, ask for a consultation, 15 minutes, jump on the phone. Hey, what do you do? What's your approach to this? What kind of success rate are you having? And if it sounds a lot like what we've been talking about here, you're probably knocking on the door of a winner versus somebody that might just give you the same old answer. Well, we'll look at it. We'll balance out your hormone based on where your TSH is at. And you hear this thing over and over again. It's like, little flag. This is more of the same.
Wow. Now, do you do any DNA testing for your patients or any epigenetics?
Yes, absolutely. So there's a lot of genes out there that we believe are incredibly important. One of the things that we use for a lot of patients is the strategene sequencing from Dr. Ben Lynch from Dirty Genes. I think there's a lot of SNPs that are very important with this type of issue. Detoxification, phase 1, phase 2 is very, very important. We've learned that both in primary and secondary hypothyroidism, detoxification has a key role. So in primary hypothyroidism or Hashimoto's, patients that have detoxification issues are going to have chronic inflammation right out the gate because they're not clearing properly. Phase 2, and then patients with secondary hypothyroidism, which is non-Hashimoto's, we've learned that there's a link between the liver and the thyroid. Mm-hmm. When toxic burden is high, the liver will signal the pituitary to slow the thyroid because thyroid controls metabolism. And the faster metabolism is going, the quicker you spread all this crap in your body. So sometimes we have seen patients with secondary hypothyroidism. They represent that 8% of low thyroid patients that you start cleaning everything up. I'm sure you've seen this. You clean their diet, you cleanse them, you detox them, and all of a sudden it's like they're back online. Their thyroid function, their thyroid conversion starts working a lot better, and they feel way better. Their symptoms begin to clear. So that's one. And then there's so many. Histamine clearance is super important to keep inflammation in the gut and in the immune system low, especially for those primary hypothyroid. MTHFR, we hear so much about it, definitely a very important player. We want to make sure that methylation is always happening properly to reduce oxidative stress. When oxidative stress is high, cells will die, they'll rupture, and the most inflammatory thing in our own body is our own DNA. So if cells are dying, they're breaking open and DNA is spilling into the circulation, the immune system is going to be jacked. It's going to be crazy. So making sure that methylation is good is super important. There's now a lot of talk about HLA DRDQ genetics, patients that are susceptible to biotoxin illness. Super important. They have a much higher risk of autoimmune disease because their body, their immune system cannot clear toxins that they're being exposed to from mold or from Lyme or from Sigwa or from Bloom or from any of these sources that may contain biotoxins. And so that's another gene or genetic implication that could be important.
Fantastic. Now, cognitive disorder has been one of the diseases that has been basically invading our older members and the population, especially in the United States and Canada. Now, I know you have a specific protocol for this. Can you please give us a little breakdown? Let us know where your research has gone and taken you to.
Yeah, absolutely. So it's not my protocol. I trained in the Bredesen Protocol through the Institute for Functional Medicine. The first round of doctors that were trained for this in the IFM, it was a whole process. You had to apply, you had to be approved. So I came out of that first cohort. We were about 200 doctors. And so that gave me the opportunity to be one of the people that has been doing the protocol the longest. As part of that, I also had the opportunity to begin to teach other doctors in my previous assignment, which was a company called the FM Shift. So I was doing consulting for about 24 of the biggest functional medicine practices here in the United States. So obviously that amplified my experience with the protocol even further. To speak into what you're talking about, absolutely. You know, not only are our bodies becoming sicker as a society, but we tend to think of our brain as this separate, disconnected entity that's kind of doing its own thing. But our brain is responding and it's being affected by everything else that's going on in our body. So we've learned a ton about the process of cognitive impairment and eventually dementia, the most common form of which is Alzheimer's, which is now, we believe, becoming epidemic. We believe it's probably the next big epidemic with the baby boomer generation, with the aging population. We're going to start seeing much greater prevalence of cognitive disease. Now, this is complex right out the gate because there's medical legal issues around dealing with patients with cognitive impairment, right? Their ability to make their own decisions and all that type of stuff. So something important, very, very important for providers is being able to know and understand what kind of patients they should select into the protocol, and what kind of patients, unfortunately, as much as they would want to give them the opportunity, might be too far gone into the progression of the disease to bring them onto a protocol like this. Now, the results of the protocol, they've been published. There's thousands of patients that have gone through the protocol, and the success rate is over 90%, according to the ReCoDe Institute. So it's a very, very successful protocol for the right patient. So I'll leave it there and let you kind of jump in and direct.
I wanted to talk about the cognitive decline of the population, specifically on a certain age. What has been the causes, and what's fueling this speed that we are going to and losing our memories, cognitive function, and our faculties ultimately?
Yeah, so the research has shown that there's 5 major underlying causes, and they're so unique that they're being typed, meaning there is such a thing now as Alzheimer's type 1, type 2, type 1.5, type 3, type 4, type 5, right? And each one of these is going to speak into the major triggers that are causing the disease. Hopefully, we'll get to the point where everything's going to be like that, right? Low thyroid, you have it because of primary, secondary. These are the causative factors. These are the influencing factors, and we can get to that level. Same thing with diabetes. There's 6 forms of type 2 diabetes, and everybody's given the same treatment. So it's really awesome that we're here with cognitive impairment. Type 1 is inflammatory. And think about all the things that drive inflammation. Number 1 and biggest one is diet, right? Mm-hmm. Diet, the standard American diet, is probably the most inflammatory diet in the world. Toxic exposure, infections, viruses, a compromised immune system that's allowing these infections to continue coming into the body without resolution. Certain medications, chronic stress, all of these things contribute to a subtype 1. Subtype 2 is called trophic deficiency. So the brain needs a lot of really important stuff to continue building and clearing its neural pathways, neuroplasticity. So amongst the many things it needs neural growth factor. It needs, to have enough hormones in a male testosterone and a female estradiol. It needs healthy fats. It needs, B vitamins. It needs all of these pieces that help it build itself and clear itself. It needs sleep. It needs exercise. All of these are important trophic factors. Deficiencies there will cause neural retraction, will cause cognitive decline. Type 1.5 is glycotoxic, probably the fastest growing demographic of the cognitive impaired population, because these are the people that have blood sugar issues. So either high blood sugar or high insulin levels are very damaging to neural tissue. Neurons are very, very sensitive to fluctuations in blood sugar, and they can develop something called advanced glycation end products, which is like sticky crap on there that can cause these neurons to die. So we know that not just in diabetes and prediabetes, but most of the American population has some type of blood sugar issue, right? Either they're consuming too much sugar, too many carbs. So this demographic is one of the demographics that's driving the explosion of cognitive impairment. Subtype 3 is toxic illness. And here there's a lot of talk about inhalational exposure. So inside of buildings that have had water damage, inhaling some of the nanoparticulates from mold, they can be absorbed through the cribriform plate and go straight into the frontal parenchyma in the brain and begin to drive the process of impairment. Same thing as heavy metals exposure, which we've known forever: mercury, lead, aluminum, cadmium. Type 4 is vascular. We've always kind of seen vascular dementia and Alzheimer's dementia as very separate, but now we know there can be a lot of overlap. So something that would be a fully independent vascular dementia would be somebody that had a major stroke or a bleed, an aneurysm, and they got dementia afterwards, that would be a pure vascular dementia. But most patients that we look at in their brain imaging, they can have atherosclerotic plaquing issues, they can have small vessel disease of the brain, and we know that that reduces trophic support and is an overall contributing factor for Alzheimer's. And the last one is traumatic. So we've all seen football players, boxers, people that get repetitive head trauma or sometimes one major head trauma, and that sets off the entire process that triggers the neural retraction that's classic to cognitive impairment and ultimately Alzheimer's. So these are the 5 things that we know are the primary reasons why people are getting these diseases. And as those threats become ever more prevalent in our society, we're seeing now more prevalence of the disease process.
You know, what's amazing is that the diet and toxins, doesn't matter what you're talking about, come into play. There's a book named Sugar Crush, written by a neurologist in Arizona. And he explains basically all the pathology that goes behind most of the kind of cognitive disorders because of the consumption of sugar, which you just clearly explained why and how it was. Now, with the protocol that you said, what is in the protocol and how one would get help or find the doctor who does the protocol?
Very good. So just like there's 5 major threats, we talk about 5 pillars of care. So foundationally, pillar number 1, and this is not for every patient, but a ketogenic diet for patients that would qualify. It has a lot to do with genetics. There's a gene out there called ApoE4. Some patients that have 2 copies of that gene have a big issue transporting lipids. So on a keto diet, it might increase the risk of a cardiovascular event. So for that small percentage of the population, the MIND diet would be the preferred approach. So those 2 food approaches, the keto diet is very specific. It's called the Keto Flex 12-3, which primarily uses plant-based fats, which we all know, you know, like avocado and coconut and all that stuff. So food is going to be super important, cleaning that up. And the reason why ketones are important is because we know that for most of these patients, the blood sugar mechanism in these neurons is all messed up. Using glucose in the neuron is a very ATP expensive process. It requires about 16 ATP. When we are converting our fats into ketones, ketones go right into the neuron. There's only 4 ATP that are consumed in the entire process. So it's very energy efficient, and the brain can get a lot of energy, and those neurons can get a lot of energy from the ketones. So food is going to be super important, cleaning that up. Removing the things that are making holes in the gut, like gluten and dairy and all the stuff that has Roundup in it. You know, get that out of your life yesterday. French fries that are fried in crappy oil and all those things. Number 2 is going to be exercise. Exercise, the right type of exercise, which is going to be high intensity interval training, is going to fulfill a few really important purposes. Number 1, increase blood flow into the brain. Number 2, by increasing lactic acid concentration in muscle, you're going to start driving growth hormone and neural growth factor, which are critical hormones for the building of new pathways in the brain. And in addition to that, you're basically going to get yourself in better cardiovascular health. What's good for the heart most of the times is good for the brain. Number 3, we want to make sure that you're sleeping really, 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 really well. Sleep is one of the biggest drivers of cognitive impairment, and you've probably been seeing all the articles I've been seeing coming out about the sleepless generation, all these women currently that are having, you know, their sympathetic nervous system, it's like the gas is down all the time and they can't switch it off, and they can't sleep, and they can't rest, and they can't meditate, and they can't focus. That stuff is like ground zero for Alzheimer's, because during sleep, a lot of very important things happen in the brain. We groove pathways that we've created that day from whatever we've learned, from whatever we saw. We're grooving, we're nourishing those pathways. There's also a process called autophagy, where the immune system in the brain begins to clear debris and remove all the crap. And those amyloid fragments and those amyloid precursor protein fragments are being cleared out, allowing those connections to form properly. So the third thing is going to be intermittent fasting or fasting, making sure that we're not eating right before we go to bed. Super important, because that way we're not driving our insulin up, we're not driving our blood sugar up. Fasting also drives autophagy, so when we're not giving the body nutrients and food, we can allow the immune system to kind of redirect itself to this process of cleaning and clearing. And then lastly, very important, is brain training. We want to train our brain every single day. On step one, we want to remove the threat, the things that are making the brain sick. Number two, we want to put demand on the brain so we can create new neural pathways. We want to groove new neural pathways. And number three, we want to give the brain the stuff it needs to be able to build those new pathways. And so from a bird's eye view, that's really how it would work.
Dr. Valdes, I thank you. It's an exceptionally in-depth discussion, and I think it deserves more time, especially speaking about diabetes and how it connects to everything, and especially insulin. I mean, it almost sounds like it's root of all evil. Now, for our viewers,
it can be, for sure.
Where can they find you? And please name us the 3 books you have authored and written. And where can they find you? All the, Facebook, your website, and everything, all the information that they need to get you, please let us know.
Yeah, absolutely. So currently, I am in the process of developing the first ever trademarked and franchised functional medicine system in the United States, together with my business partner, Dr. Ruben Valdes. So Novis Health, Novis Health, is the name of our company. I currently see patients out of Charlotte, North Carolina. We have another location in Denver, Colorado. The website is www.novis.health. That'll kind of bring you into our circle. We have pages on Facebook. We are on Instagram. We have a YouTube channel in which you can see a lot of the work that we do, patient testimonials, explanations of our systems, our treatments. As far as the books, my first publication, From Diabetic to Non-Diabetic, is found on Amazon. It was rated as an Amazon top seller, so that can be found through Amazon. My next 2 books, The Thyroid Hack and Awakening from Alzheimer's, those are recent launches, and they're actually our most popular books. So we are on our way to developing, to having a publication and a publicist for those books. So they're still not available in the market. If somebody is interested in them, we were given copies of them, so we'd be happy to share those right now. And if you want to read them, post a review on them before they're released. That would really, really help us. So yeah, I think, did I cover everything there?
You got it. And
cool.
Definitely, we would hopefully get you back on some perfect time for you, and we can discuss more about this time. For sure, we will cover diabetes and insulin.
Awesome. I would absolutely love that. Thank you so much.
Valdes, thank you so very much. Anytime. Hopefully, you have enjoyed this conversation as much as I have. Our viewers, this was another fantastic interview coming to you guys with wellness influencers. I am Dr. Kaveh Elahiyoun. I bid you guys goodbye, and hopefully we'll see you next time. Good day.
Thank you, Doc. You too.